Hello all, I'm Dr. Kaustubh Moite, your pediatric pulmonologist. Welcome back to my channel, Pediatric Pulmonology. So after my last talk on the basics of physiology of cough and importance of cough reflex, we move to on another important section. In this session, we shall be talking about specific causes or pointers that the patient will present which will guide us to diagnose the underlying etiology of cough. History is of utmost importance when it comes to evaluation of cough, and proper history helps us to first differentiate whether the cough is of pulmonary or extrapulmonary origin. First, let us go through some of the pulmonary symptoms. Chronic wet or productive cough is mainly suggestive of suppurative lung disease like protracted bacterial bronchitis, chronic suppurative lung disease, or bronchiectasis. It is also seen in aspiration pneumonia or abscess or cavitations secondary to any infection. A typical wet cough sounds like this. Hemoptysis or blood in sputum is mainly suggestive of infection, interstitial lung disease, bronchiectasis, or an underlying autoimmune lung disease. Wheeze heard at rest or on exertion is suggestive of underlying obstructive disease like asthma, bronchiectasis, or an eosinophilic disorder. Dyspnea at rest or on exertion may again point towards underlying asthma or a long-standing progressive lung disease. Some cough have a peculiar sound like barking cough as seen in croup, or whooping cough as seen in pertussis. This cough is characterized with a series of cough followed by an inspiratory whoop and post-tussive vomiting. Recurrent pneumonia should make us think in terms of immunodeficiency, obstructive airways, or any other condition which can cause bronchiectasis. Timing and triggers for cough episodes also help us to pinpoint the underlying etiology for cough. Cough, which is initiated since the neonatal age group, strongly point towards congenital anomalies related to airways, immune dysfunctions, or conditions like primary ciliary dyskinesia, which may later cause bronchiectasis. Onset after an episode of choking is very typical of foreign body aspiration. Many parents bring their children with cough which worsens when the child is anxious and subsides when the child is distracted and is completely absent during sleep. This is very typical of something called as habit cough. There are various associated symptoms along with cough which can guide us towards the diagnosis. Cough with an underlying cardiac disease may point towards a cardiac cough, which may be because of pulmonary edema or pulmonary arterial hypertension or any other midline anomalies like tracheomalacia. A child with an underlying neurological disorder or developmental anomaly may have cough secondary to micro or macro aspirations. Cough along with feeding difficulty is secondary to any laryngeal or tracheal disorders. Failure to thrive with cough is seen in various long-standing severe lung diseases like cystic fibrosis, immunodeficiencies, or chronic infections like tuberculosis. Presence of cough with an underlying autoimmune disease should point towards an interstitial lung disease. Chronic use of drugs like angiotensin-converting enzyme inhibitors may lead to a drug-induced cough. Besides history and associated conditions, examination findings like digital clubbing, chest wall abnormalities, and cyanosis also points towards a long-standing progressive lung disease. So that covers up most of the specific pointers which will help to correctly diagnose the underlying cause of cough in pediatric age group. I hope this short session will help you practically to diagnose the exact cause of cough. I shall be soon coming up with other topics related to pediatric pulmonology, which I am sure will make your understanding the topic much better. Thank you.